and welcome. I'm Anna Wild, the Birth Whisperer, your guide from a bad birth to a better birth. Quick story. A friend of mine told me about her traumatic birth, and part of her experience involved the anaesthetist coming in with a trainee anaesthetist, and they didn't say hello to her, didn't acknowledge her, didn't introduce themselves, and proceeded to put the needle into her back. She was feeling pretty anxious and scared. It was quite a hard birth already. And they started talking about sport and basically didn't even acknowledge that she was present or treat her with any kindness or respect like a human being in a challenging situation deserves. So I know that there are many kind doctors, but I was like, wow, how can this happen? And I would so love to talk to an anaesthetist one day who really makes kindness and compassion and connecting with the women he works with in a really personal way a priority. So one day I found this article about a doctor called Dr Robin Youngson, an anaesthetist from Auckland, New Zealand, who had at some point in his career decided that he needed to make service and compassion a bigger part of his practice, and he discovered all sorts of things about the benefits of being kind, like fancy that. And I also wished, wow, wouldn't it be great if I could talk with him? And then finally, now I've got this platform to share these wise words from amazing people with you, and I sent him an email and said, could we talk? And he said yes. And so today I am so thrilled to be able to share the words of wisdom from Robin Youngson with you. And definitely, if you want to have to be treated with respect by care providers, by doctors during your birth experience, if that's really important to you, or if you think you will probably be having an epidural and how can you have a better epidural experience, then keep watching, because Robin is really the star of this show. He is living in New Zealand, but he has worked and travelled all over the world as an anaesthetist and specialist, and he's given advice to the World Health Organization to do with patient safety and putting people first. He's also the founder of the organization called Hearts and Health Care for compassionate behavior and attitude in healthcare, and has written a book by the same name. He's also contributed to my current favorite book called The Roar Behind the Silence: Why Kindness, Compassion and Respect Matter in Maternity Care. Love this book. He's written 2 articles in this book. And so without further ado, let's talk to Robin. Thank you so much, Robin, for talking with me today.
Pleasure, and it's really lovely to talk to you again.
Great. So to start with, can you explain a little bit about what your role has been in attending women giving birth?
Oh my goodness, yes. So I'm an anaesthetic specialist here in New Zealand, and for many, many years I've found myself on duty at maternity units, responding to calls for epidural for pain relief, for instance, often in the middle of the night, doing preoperative assessments, sorting out poor women who come in with terrible vomiting and the midwives can't find a vein. So as an anaesthetist, I've got the skills to do that. Anaesthetising women for cesarean section, and anything to do with maternity care, kind of at the sharp end.
Okay. That cold face, really. Well. Yeah, right. So you tell this really wonderful story in one of your books about a woman who had a particularly traumatic birth first time, and then she's booked in for a cesarean section the next time, and she's really terrified. And this story is such a great example about how your attitude changed to being more of service, and how being compassionate can really help women. Can you share that story?
Sure. Maybe I should go back a bit to kind of how I was.
Great.
Because I trained for 14 years to become an anaesthetist, and I had a job in the biggest teaching hospital in New Zealand. I was pretty enamored of my heroic skills, and I could do really complex technical medicine in the operating room and in ICU. And I guess that the whole of medical training is about a process of being really detached and objectifying patients, and not really seeing the person and the patient at all, focusing on the pathology. So my approach to patients, even maternity, used to be that kind of detached, kind of clinical way of, how do you do? My name's Dr. Youngson, I'm your anaesthetist. Tell me about your asthma. So, not even a kind of meeting as a human being, but total focus on risk factors and and disease processes. And over many years, I've learned that actually the emotional experience of patients is incredibly powerful in helping to determine clinical outcomes, and that I get much more joy and satisfaction from my practice if I treat each patient as a human being and really attend to their emotional experience as well. So a good example would be the question you've asked me, which is a patient who's had perhaps has for the first time in labour, it's gone really badly, and there's been obstructed labour, and eventually the poor mother comes to the operating theatre for a C-section. She hasn't slept for 2 days. She's completely exhausted. She's terrified out of her mind. The midwife hasn't slept for 2 days either. The husband is at the end of his, tether, and it's just an incredibly stressful situation. And maybe the mum had an epidural and it didn't work so well, and she experienced pain during the procedure, or other things that just caused a lot of distress and discomfort, and everyone around them was kind of detached or uncaring. And I've met a lot of women who've had just incredibly traumatic experiences of a C-section, and then they're pregnant again, and because of the history, they're booked to have an elective C-section. And that at least gives me an opportunity to meet a mum before she goes into the operating room and spend some time with her, and tend to those things. So what I've learned to do now as a clinician is really, it's so important to make the human connection first, to put people at ease, to get down to the level of the patient. I ask permission to sit on the mum's bed and actually wait until she gives me permission before I do that, because I want to be respectful. I want to give a sense of power to that patient, that she is kind of in charge of this, and that we're not just doing things to her because she can feel very vulnerable. So I always get down to the patient's level. I use a bit of humour, and then when we've made I explain who I am, because I'm just yet another person in scrubs. I could be anyone. I could be an orderly, a surgeon, and who knows what the word anaesthetist mean or how to spell it. So I make sure she knows what my role is, and we make a connection as human beings, and we get down to the same level. And then I ask the mum, how are you? And I watch so intently for any signs of anxiety or nervousness, which is almost universally present. And you see the hands kind of going like this, and you're looking a bit apprehensive, Anna. Did you get any sleep last night? Oh no, I've been awake since 3 o'clock this morning. Okay, what were the thoughts going through your mind at 3 o'clock in the morning? Oh, I was really worried about this. And so you find out what's really important. And often when you come into the room, there's a kind of sense that the mum is not even in herself. I kind of have a sense that she's halfway up the wall. Her kind of spirit is not centered within herself. And as we begin to talk and build some rapport and trust, I get this powerful sense that the spirit is coming down and back into the body again, and all this kind of nervous tension goes away. So if there has been a very, having made that rapport and connection, then I'll get to hear the story of the trauma, because what I've found in my clinical practice is that the more frightened a patient is, the less likely they are to tell you what's really worrying them. It's kind of a paradoxical rule. So often I'm very privileged to hear for the first time a really full account of how traumatic that was. Now, in the past, I used to make excuses for what went wrong, which really invalidated the patient. So now I refrain from doing that, and I just try to validate the patient's feelings and let her know that, I really understand how traumatic that was and why she should be so frightened and concerned. And, those are the kinds of things that reduce the anxiety and build the rapport. And then my intention now is for her to have a wonderful experience of an elective cesarean, for it to be completely calm and relaxed, for this to be joyful, for this to be a really emotional experience in a positive way. So I go about creating the perfect cesarean before we even go to the OR. So I think of it as an act of co-creation. So what I do is I say, well, I'd like to just explain to you, how we're going to do this. We're going to slow it right down into little steps. At each step, we're going to make sure that you're okay. And I'm going to be right there with you every single minute of the case. And I've got two jobs. I've got one job is to stick the needle in your back, which is, easy, and we can make it painless. But the much bigger job I have is to make you feel relaxed, safe, calm, to give you a great experience. I'm just going to be there with you every time. And I'll take her step by step through the whole procedure so that we're creating in our minds together the perfect idea of, the cesarean section, so that it's in an image of my mind. And I'm very careful with the suggestion. For instance, anyone having a C-section awake is going to experience discomforts and side effects. And informed consent says that we're supposed to list all these things. You could get a headache, you could be really shivery, you could have pain, you could, feel sick, you could vomit. You could be paralyzed from your epidural. What a dreadful set of suggestions to make to a patient when they're about to go into an operating theatre. So we do have a legal duty to warn of serious complications. But there's a wonderful practice that comes from Cleveland Clinic called Informed Hope. So I'm replacing those suggestions of the things that can go wrong with all the things that can go right. So when I'm talking about side effects, what I say is that there are some side effects or discomforts that you might experience. I want to let you know that we have really good remedies for those, and they're going to be available just there on the side. But my intention is that you're going to go through this whole experience really relaxed, really comfortable, and at the end of the case, those remedies are still going to be sitting there on the side and we didn't need them at all. So I'm using quite powerful imagery and suggestion. So I haven't described or mentioned any of the side effects because I don't want to suggest that. And by the end of this process, there's a wonderful sense that the mum has come back into herself. All the kind of jangly energy is settled down. She's relaxed and comfortable. And I say to the patient, you're in charge of this process. We're just going to really slow it down, and at each step we'll make sure that you're okay. Because when you've been traumatized and abused in the past, the fear is that people are going to do really bad things to you and you have no control. So that, makes it really joyful. And I also, I do other things to build the patient's confidence. I say, you're really lucky you have a wonderful obstetrician. Your surgeon is just the best person. I've worked with him for many years. If I had to choose a surgeon for my daughter or my wife, that's who it would be. And these are the things we're going to do together just to, make sure you're comfortable. And he's really well aware that you're awake. So if you have any worries at all, just let us know. We can stop the procedure. I can talk to the surgeon. We'll figure out what the problem is, and we'll just put that right. And it's, it becomes, and it makes me relaxed too, instead of, worrying about, am I going to get the spinal in or whatever. So I think that's one of the most gratifying jobs I would do, would be to take someone who's been severely traumatized in a previous medical experience and to just recreate a completely relaxed, joyous, happy experience. So, I really like that.
Well, Robin, when you're talking like this, you're my dream anaesthetist, and I think if I ever needed an anaesthetist, which I haven't yet, I would wish it would be someone like you. And I think this is the issue that many women who've had a traumatic birth are faced with, is that they have felt like they've lost control. They have felt like they weren't respected. And like, to get someone like you is just a dream. How can they encourage that situation to evolve? Like, how can they set things up, or like, are there things they can do so that they have more of a sense that they will be respected and that they will feel like they're more in control? What?
So how do we change the whole of medical culture? Midnight. Well, I have a friend in the States. She's a really amazing lady. She's an ordinary mum, but she's become an international leader in patient safety. And she got really fed up with waiting for doctors and hospitals to do things to improve patient safety. So she realized that in any relationship, there are two halves to it. So she now teaches patients how they can be more effective and getting the kind of care that they need and making sure their care is safe. So I think mums are not completely hopeless.
I hope not.
In terms of influencing the behaviour of doctors, it's kind of hard to know how to answer that. I have two suggestions. One is that, criticising people just doesn't help at all. So criticising obstetrician for being cold or uncaring or whatever is just going to, create more resistance and defensiveness. So one of the ways to be more successful in influencing behaviour is to watch out for instances of when people do it right, even if by accident, and just, be ready to jump in and really praise and, affirm that. So So I think any time that an obstetrician or another doctor you're dealing with in a hospital kind of is more caring or open or compassionate, just really fully express your appreciation of that and let them know, doctor, I just want you to know that that makes such a difference to me, and I was quite scared coming into hospital, and I really appreciate your caring and the way you just got talked to me and held my hand. Just I'll remember that for the rest of my life. So that's kind of one thing you can do. And the other thing I think is that, if you go into the hospital and you're seeing an obstetrician or an anaesthetist in a clinic and they're being, a bit kind of detached, just to call a halt to the consultation and say, doctor, I just want to tell you something. And I want to remind you that, childbirth is an incredibly emotional event. This is only going to happen to me once or twice in my life. This is the birth of my child, and I want this to be a really safe and joyous experience. And I just want to remind you that you don't just have to do the technical skills, but you have to look after my emotions as well and do what you can to make this safe and, caring and joyous for me. And I think that would just, make a number of doctors just kind of come up short and
Robin,
really start to think about it.
How would you have responded to that, though, before you became aware that compassion and being kind and of service makes a difference? In that time when you were being more clinical, how would you have responded to a suggestion like that or to a statement like that?
I think I would have been really taken aback, and I would have kind of stopped for a moment and reflected on it. I think I would have responded positively to that. But even if I hadn't, that kind of question, that observation was kind of haunt me. I mean, I would just keep thinking about it. It couldn't help but change me,
right?
Because it would be such a surprising thing for a patient to say, and it so reframes the whole episode of care that I think it's, even if you don't make a difference to your care, you would make a difference to the care of future patients. So it's worth trying. Plus, bring your midwife along with you. But, the maternity care is amazing. It's the only kind of healthcare I can think about where patients have their own professional advocate, that goes along with them and represents them to the hospital system.
Right. So, I mean, that's certainly the way in New Zealand, but in the world, it's not always like that. Often people are connecting with only their obstetrician, and so it can be a bit different. I'd like to talk a little bit about epidurals, because it's an area that I think there's a lot of, misunderstanding or fear. And but to start with, what's your perspective? Lots of women think that having an epidural is an absolutely essential part of having a baby. Like, what do you think about that from your perspective?
What I try to do in my clinical practice is to let go of judgment and just to accept any patient for just who they are and what's important for them. I try hard to find out what is important for them and just bring my knowledge and skills in the service of the patient's concerns. So if a patient is convinced that they really want an epidural, then I'm really happy to provide that service. If they want to ask me questions about that, I'll do that.
So maybe I can ask a different question. If a woman is feeling scared about having an epidural but maybe having an epidural, is there anything she can do to reduce the risk of side effects and have a really positive experience?
Well, what I've known from a lot of reading and research I've done for my book and the work we do in compassionate healthcare is that your mind has incredible power over your body. And one of the things I use it because I use positive suggestion a lot, because I know that positive suggestion changes your brain, changes your physiology. There's an anaesthetist in Adelaide called Alan Siner, who's also trained as a hypnotherapist. And he runs workshops where he teaches the anaesthetists how to use suggestion, not hypnotherapy. But he talked about a mum who had a very precious IVF baby, and she tried for years and years and years and finally got pregnant. And then at about 20-something weeks of pregnancy, she went into premature labor, and it was an absolute disaster because the baby wasn't going to be viable. And the doctors were doing all the medications and things to try to stop it, and it wasn't working. And he heard about it, went to see her, and just asked her to imagine that she had wires and switches inside her body, and that there was a switch she could find with a wire that goes to her uterus that could turn her uterus off. And he just used suggestion and got the woman to turn off her uterus. And shortly thereafter, the contraction stopped and the pregnancy continued. Well, the irony was that she then went post-dates, and she was about 10 days or 2 weeks post-dates, and they wanted to induce her. And she didn't like the idea of this at all. So she went to see Owen Steiner again and said, can you help me? She said, sure, let's turn your uterus on. So did the same thing again, and an hour later she's in established labour with no drugs. So we know there are incredibly powerful effects. So I think what we focus on our minds is what comes true in our bodies. So if mums can really visualise and focus and read stories of and talk to people about having natural childbirth and it going well, and instead of focusing on the fears and the technology, that might make a difference.
Yeah.
And when I do an epidural, I use positive suggestion in terms of the fact that, the labour's going to go well and she's going to have a beautiful baby. And, sometimes I ask, can I come back and see your baby? Just. So I think, but people do have a lot of fears about epidurals. There's a lot of misinformation. They're fearful they might be paralysed. I've been doing epidurals for, what year is it now? For 29 years, and spinal anaesthetics. I've never seen a patient have a serious or permanent nerve injury or paralysis. Not in 29 years of practice.
So really, the importance of using your mind if you're going to have an epidural, if you're going to give birth, like if you're going to give birth in any way, with or without the epidural, to really use your mind to visualise things going well. I think I understand that because I've been involved in hypnobirthing. Yeah. I think one aspect of things that I've learned from you already, Robin, about how your personal experience of how epidural rates and caesarean rates have been impacted by compassionate care. Can you talk a little bit about that? Just so fascinating.
Every Tuesday, I would be on call with this wonderful obstetrician called Raj Kumar, and he'd worked a lot in Fiji. He was completely comfortable with a breech delivery or whatever, and I don't think he knew the meaning of defensive medicine. And he brought a very similar philosophy, and we had a very close bond. And 1 year, I did something really naughty. I worked with a data analyst, and I analysed the rate of C-sections by day of week, because doctors don't want to have data about the inter-surgeon variability. And on Tuesdays, the total C-section rate was 13%. The next day, it jumped up to nearly double.
So. Why do you think that was, Robin? Like when you and Raj were on, the C-section rate seemed to be dropping.
So part of it is, we were both very experienced practitioners, and I think both of us really thought from a kind of moral point of view that defensive medicine is bad medicine, and we were willing.
Can you explain defensive medicine to anyone who might not understand that?
Right. So a very simple example. So the woman's in labour, she's got a fetal heart rate monitor on, the trace is not reassuring. What we know is that the fetal heart rate monitoring is very non-specific. It's not a good monitor of fetal distress, but there's all these, there are doctors who have been sued because the trace wasn't good and then the baby was born and the baby had cerebral palsy. So now the courts have decided that, if you're a doctor and there's a bad trace, you've got to do a C-section. Now, the wiser, more experienced doctors might say, well, this trace is, it's not very reassuring, but, my instinct, my experience tells me it's going to be okay. There are other signs that let me know it's okay. The labour's progressing. I'm going to keep my fear in check, and I'm going to give some, positive reassurance to this mother, to this midwife, and I'm going to hold on, I'm going to watch, and I'm going to see if we can achieve a safe vaginal delivery. So that means you have to take some professional risk. So defensive medicine is that, okay, immediate C-section, and you do a C-section rate that's 30, 40, 50% of all the mums you see. Or non-defensive medicine is, really trusting to your experience and judgment and taking some medical legal risk. So that's what it means. So there would be, many times when I'm in a delivery room and, the obstetrician is, a little anxious and the trace is not good and the labour is not progressing so well. But by the force of our belief in that patient and our positive suggestion and our building confidence and our teamwork and a willingness, and an ability to respond quickly if we have to, we just dramatically reduced the number of women who had unnecessary C-sections. But I think the emotional, psychological elements of that are profoundly important. And intention, we as health professionals, we have to bring powerful intention. If we bring intention that this mother is going to have a natural vaginal birth, that's more likely to happen. The obstetrician who had the highest rate of deliveries, it was really interesting. At the 8 o'clock morning round, the handover, you come at 8 o'clock in the morning, and you got a whiteboard with a list of all the patients' names and kind of risk factors and so on. And he would look at the board at 8 o'clock in the morning and he would say, "Oh my God, I can see 5 Caesars already." And when Raj and I looked at the board, we would be imagining all of the things we can do to help and support these mums, these midwives, to achieve a safe, normal delivery. And we had just completely opposite perspectives. So,
right. So interesting.
Thoughts.
Just an additional story along those lines is how you've found it that in some cases you've needed to use less anaesthetic when it was coupled with compassionate support and positive suggestion.
Yeah. I was really... My anaesthetic colleagues can't believe how little anaesthetic I put in the spinal. And it came about by accident. I had a mum who'd actually had 3 previous C-sections. And the first 2 were fine, and the third was a very traumatic experience when the spinal anaesthetic was a bit overdosed. And as a result, her blood pressure went down in her boots, and she went white as a sheet, and she started vomiting, and she was faint and giddy, and she thought she was going to die. And the anaesthetist got in a bit of a panic because this has got rather out of control. And we do expect to see the blood pressure come down with the spinal, but sometimes it catches us out. And in his panic, he decided he needed to get the husband out of the room so that he could kind of manage this unraveling clinical situation. And the only person available to take the husband out of the room was the mother's own midwife. So at the time when she thought she was dying, the only 2 people that she knew and trusted were removed from the room, her husband and a midwife. So she was very traumatized about that. So I heard this story and said, right, we're going to make a plan. I said, what I often do, instead of just doing a spinal anesthetic where you just have to decide the dose and put that in, and you can't take it out again. If you overdose, you've overdosed. I'm going to do a combined spinal epidural. So we're going to put a tiny dose in the spinal, which just gets it started really well, and then we'll top it up gradually with some more doses in the epidural. So we can just top it up gradually. We can titrate the dose to what's just perfect for you, and we'll keep a really close eye on the blood pressure, and I can absolutely guarantee we won't make you sick. We'll make you feel as if you're dying. So we agreed on that plan together. So a normal dose for a spinal might be, for instance, 3 mils of local anaesthetic into the spinal fluid. Well, I put 1 mil, and she was quite a big lady. She was about 5'10" tall. So I put 1 mil in, and then I tested the block. And to my astonishment, I discovered she had a perfect block right up to the level of the chest we need, and I didn't need to do any epidural top-up. And I was completely astonished. I couldn't believe it was possible to produce a perfect anaesthetic with 1 mil of local anaesthetic, but she had a completely pain-free, 0 side effects, joyous, happy.
Wow.
So that taught me something. So thereafter, especially working with this obstetrician who was, very patient, I said, look, I'm going to use this technique more often and put a small dose in the spine. And if I need to top it up, we can do that. It's quick and it's easy. The surgeon doesn't mind waiting a few minutes. So I discovered that you could use dramatically less anaesthetic, and that really reduced the side effects. But what was so important was all the positive suggestion, the support, the emotional support, the creating the picture in their minds of how things were going to go.
Wow.
So it was the combination of a small dose of anaesthetic and really that compassionate caring that made it a joyous job. But my colleagues wouldn't believe that you could do a cesarean section on 1 mil of local anaesthetic till I actually demonstrated them.
It's wonderful, Robin. And Finally, if someone feels very moved by what they've heard and they want to become involved in what you're doing, what can they do?
Okay, well, other than my work in maternity, and at the moment I only do part-time clinical practice, I do locum work in just small hospitals in New Zealand that are short of doctors. I go out and help out for a few weeks. The reason for that is that 4 years ago, my wife Meredith and I, we quit our jobs, we sold our house, we downsized, and we launched an international movement to try to rehumanize healthcare and strengthen compassionate caring. So it's called Hearts in Healthcare. So the website is heartsinhealthcare.com. So it's all just one word, heartsinhealthcare.com. And we have a huge range of resources, stories, research, resources you can download. We have an online community. We've traveled to many countries. We've been all around New Zealand, Australia, to the USA, to Canada, to Hong Kong, to Saudi Arabia, to the Netherlands, Norway, the UK, to Ireland. And we're just, wherever people invite us to present at a conference or run some workshops or do consulting work, and we're just trying to build an international movement to rehumanize healthcare and strengthen compassion caring, not just for the patients, the people we care for and their families, but for those who work in healthcare. Because what we know from a lot of stories and research is that this kind of disconnected, detached practice turning into a robot is really the risk factor for burnout. And when we bring our whole selves to work, when we bring our heart, our compassion, our caring to the care of patients, that's what nourishes us. That's what grows our own hearts. That protects us from burnout, gives us joy and meaning in our work again. So we're just working all around the world trying to encourage that as a social movement. And it's really encouraging in the last year or two, the professions have started to pay more attention. We're getting more invitation. It's getting a bit overwhelming now. I want to spend some more time at home.
Well, Robin, thank you so much for taking this time to talk to me amidst all of these invitations and things really growing. And I just hope that Hearts in Healthcare keeps growing and that one day women can potentially access a database of all the obstetricians who really support compassionate care.
Yeah, maybe they can one day. But really admiring your work. I love your website. I love, all your writings and your blogs, and I really admire what you do. So I'm looking forward to meeting you in person in Nelson in October.
Thanks, Robin. Wonderful.
Okay. Thanks so much for the call.
Thanks so much for watching. If you've been inspired, share now, because your voice supports positive, respectful childbirth for mothers and babies everywhere. Share this link with your friends, post on Facebook, make a comment below, and sign up for better birthing wisdom at thebirthwhisperer.com. See you next time.